This month is Gastric Cancer Awareness Month. In light of this, we have asked Dr. Fonseca, a medical oncologist who works with the EU H. pylori eradication project, to talk about the importance of gastric cancer, his ongoing evidence-based health policy that will change the scene of gastric cancer, and what other countries can also learn from this. Hello, Dr. Fonseca, how are you today?
Hello, Doris. I am fine. It's a great honor to be here with you from the Imperial College and to can participate in this talk about our program.
Can you introduce yourself quickly and what your role is in gastric cancer?
Hello, I am a medical oncologist. I am doing my PhD in public policy, in health public policies, and I am working with a group in the program of European Beating Cancer Plan in Portugal. With ICIB, we have a group of prevention of cancer, and we are a group with 10 persons from different fields, some from academics, other from pharmacies, community pharmacies, others as medical oncologists, others from patient associations. And we test what can we do different in prevention. We have some ideas, and then we think that in gastric cancer that this is a very important cancer, that we can do something different in prevention. So we have this program about prevention of gastric cancer in Açores.
Could you elaborate a little bit more on what the program is doing?
So what we are doing is a pilot test to understand what is the way of testing these patients. If we can use all the health system, for example, if we can use the pharmacies as a part of the public health system to change the capacity of the health systems for better. So the project have different goals, have a practical goal in the life of that population of the island of Terceira in Açores, but have also a goal of the survival of the health systems in the cancer area, just giving more value to prevention and to the biosocial area, and to treat patients before they get cancer. Helicobacter pylori. We know that this is one of the main factors that can be prevented or that can be treated. And if we treat the Helicobacter pylori, the people will have a lower incidence of gastric cancer. The best treatment is to treat the patients before they get cancer. So I think the health systems should look for prevention, and it should look a major investment in prevention of cancers, all areas of cancer. In this case, we are talking about gastric cancer. What are the behaviors that we can change that can lower cancer? For example, in this case, smoking, alcohol, what do you eat can have a lower impact in gastric cancer. So we should make health literacy and educate the general population to have lower rates of cancer. Then, if they have a risk factor, in this case, Helicobacter pylori, if people can test it in an easy way, and the most easy way is in the pharmacy, not in the health system, not in the primary care, not in the hospitals, to test using all the health system, using the pharmacies, and they can test, and then all the people that need and to make the eradication can go to the primary care, or the people that need to make endoscopy can go to the hospital. So that's the way that we can use all the health system to be in the best possible way. The biggest problem that we have right now the focus of the health system is to treat disease. We just treat people with disease, or the majority of the money, the majority of the research go for people with disease, and we should go for people before they don't have disease. That will be a better investment. But I think the future of the health systems will be the biosocial area. What we are trying to test, what is the better way of doing eradication of Helicobacter pylori, and how can we use the pharmacies to do the eradication of Helicobacter pylori? What are the results in a specific area, in this case of Açores, that we have, for example, how many people want to make the test in health literacy? If the people understand more about gastric cancer, are the people interested in doing this kind of tests? The people go for the test or they don't go for the tests. So what we are testing, and we see lots of people with Helicobacter pylori. What is the percentage of people that we see with Helicobacter pylori in this island? Is this number of people with Helicobacter pylori should need it for an implementation of a policy? Because normally, when we have a public policy or a health public policy, it's a change by law, and then everyone tries to adapt. We are testing a policy. For example, this is a quite new thing. We have one thing that is called evidence-based policy. So we have the people with placebo, we have the people that are taking the drugs, and then we understand if we have difference in overall survival, quality of life. One of the most important things of this project is to test in the practice, how can we change it? And we hope that we can have the results this year, and to show to the scientific community what have we learned with our project, and how do we think that they can adapt this eradication of Helicobacter pylori in Europe or in the West world. Our health system, the way that is designed, the way that is supported, I think it will be easy to implement in Europe, or people that have the same health system principles as Portugal have, but I don't know if it's the same system that you have in Korea or that you have in Japan. So I think maybe they are different health systems, and one of the interesting things that we are testing, it's a policy. We are not testing the drug. If we test the drug, we can implement it in another countries because the drug is the same. So we can say that, but that population it's a little different, or the Asiatic population can be different for gastric cancer. I try to bring something different. For example, not what is the best that we are doing, but I think what is the new. And I think what is the new is biosocial area, prevention of cancer, because now what we see in the future, we'll have blood tests to understand if people have cancer before they have cancer. That will be the future of the majority of cancer. And this idea of biosocial area, social innovation, and to do the same of a clinical trial, but in a policy, this is for you that want to go to global health. It's very interesting.